Hello, this is Dr. Gay from First Sick MRI, and this is a 59-year-old female who complains of lateral sided ankle pain. She has a marker over the lateral ankle here behind the peroneus tendons, indicating the site of clinical concern and pain. On these views, these are both axial views, we see the marker here. This is called a T1 weighted view. This is a fat suppressed proton density view. On this, we see better the brightness here in the soft tissues, lots of edema in the soft tissues. We also see the peroneus tendons here laterally. As we follow the peroneus longus tendon down, the one in back is the longus, and the one in front is the peroneus brevis. So these two peroneus tendons, the longus and brevis, go behind the fibula. Here's posterior, and one of them looks normal, the peroneus longus. If we follow it up and then down, it goes behind the fibula, and it looks nice and dark and normal. The peroneus brevis, which is in front here, surrounded by fluid, the peroneus brevis comes down, and on this view it starts to become thickened and irregular, abnormal signal, and we watch it wrap around the lateral margin. So it looks broadened and irregular, partially torn, wrapping around the lateral margin of the fibula rather than behind it. So we have a partial tear of the peroneus brevis tendon and prominent edema in the soft tissues around it. But that's not all. We also see some brightness within the distal fibula. So the fibula has marrow edema. Fibula over here, the marrow edema shows up as low in signal. Here it shows up as bright. If we look straight at the patient on this view, we see the tip of the fibula right here. We see the brightness in the bone, which means there's marrow edema. And the darkness of the bone right here, marrow edema. We also see that edema and inflammation. All that gray intermediate tissue over here is all inflammation related to the partially torn peroneus tendon and the edema in the soft tissues. But there's something else rather striking, which is this. This bone, this is the calcaneus. It's abnormally angulated. Normally it will go along the long axis of the tibia, and talus is the talus. It'll come down this angle, but instead it's angulated 30 degrees out laterally. So we call this abduction of the calcaneus, or hindfoot valgus deformity. And the hindfoot valgus can be associated with people with flat feet. Over time they can get this valgus deformity where the calcaneus angles outward. And this is more of an extreme case where the calcaneus is impacting with the distal fibula. Normally the distal fibula is here and the calcaneus is way far away, but here this is rotated outwards, and we see this impingement or bone-on-bone impaction between the tip of the fibula and the calcaneus, and we see the resultant marrow edema and also the abnormal findings of the peroneus brevis tendon related to this bone deformity. Now these patients, besides getting the subfibular impingement or this calcaneofibular impingement where the bones knock together and cause marrow edema, they also will get impingement over here between the talus and calcaneus. And this patient doesn't have any marrow changes related to that, but this area here, this is the sinus tarsi area, this is narrowed, and there's also a little bit of darkness or intermediate signal within the sinus tarsi, so some chronic inflammation related to this narrowing, this subtalar impingement as well. So a case of hindfoot valgus deformity where there's abduction of the calcaneus, rotated outwards, where we have a fibula that's impacting with the calcaneus, subfibular impingement or calcaneofibular impingement with marrow changes of the fibula, and also narrowing of the lateral talocalcaneal space here, narrowing of the sinus tarsi inflammation, and then lastly, and the thing that's really resulting in some of our symptoms is this partial tear and tendinopathy and edema of the peroneus brevis tendon. And that's it. Thank you very much.